The Duties of a Doctor programme is designed to be bespoke to the needs of the trust that we're working with. As an example here, we've designed a 6-month programme where we meet the doctors once a month for one afternoon and we cover off a different area of ethical guidance. We co-designed the programme with Dr Grant, who's the Associate Medical Director at Barking, Havering and Redbridge University Hospital Trust. And he identified a group of doctors who were new to practice in the UK, new to the trust, and perhaps didn't have access to the same educational resources that consultants or doctors in training had.
I think one of the important things that already has come to the fore is the GMC being here, very friendly, several members of the GMC, and the way they've approached these doctors has sent a very powerful statement about the way that they want to engage them, help them and further their career. I think that's been so helpful already.
The course has been quite informative, educative and also interactive. Over the past 4 weeks we've come to understand a bit more about what the GMC does and how much support the GMC can offer us doctors.
I did last night. After 2 hours of sleep I was very keen to come here. So it's very nice, and having chat with everyone. This is like visiting old friends like that. So I like it very much.
There's been a lot of laughter. We've had some fun times. You know, they've been able to share things that, you know, when people say things like, I would just want to ask a really silly question, and they can ask questions that, you know, maybe they've been wondering about forever, really. And I think that's been really powerful as well.
I think the programme has gone extremely well. There's been a very good retention of the doctors, and I think this has demonstrated the interest that they have in this programme. This was the first cohort of doctors, and they were obviously SAS doctors. We're hoping that we would be able to roll this out to other groups. Clearly the needs of this type of programme will be different according to the cohort that are in the programme. However, what we can say is that the SAS group of doctors are a group of doctors that have not perhaps been so valued by the NHS, and who can now enter this kind of programme and learn more about the GMC, learn more about the culture of the NHS, which can only improve their quality of work and thus result in better patient care. I think the other thing is that this kind of programme can help cohorts of young consultants understand exactly what the wider remit of their jobs are, enable them to feel more secure in what is a very challenging and stressful environment.
The best way to get involved if you want the Duties of Doctor programme in your trust is to contact us, really, the Regional Liaison Service. We can work with you to tailor the programme to your needs, to look at things that are important at your trust.